Live it is. Live from Stoneham. It's Scissors and Scrubs. Live from Laura's basement.
Oh, yeah.
Scissors and Scrubs.
Palace down here.
So, welcome back.
Mm-hmm.
We're out of the mountains and out of the snow, and we're not eating anybody. We're moving on.
Yes.
In the month of January.
We've gotten past that.
We decided to get back to roots,
Mm-hmm.
and we're going to actually talk about some medical stuff in this episode. As much as I'd love to hear about cannibalism and freezing to death. And,
which do have medical points.
yeah, it is a quote-unquote medical podcast.
Mm-hmm.
You know, I think we should cover something.
I guess.
I was very excited today because I bought a new mattress. Laura's been hearing about it all afternoon. I went to the mattress store with Brian. Now, it's hard because I want quality and my husband just wants cheap.
Yeah.
He just wants the cheapest thing he can find.
Yeah.
So we go to the first mattress store, and of course, I love these salesmen. They bring you right over. Here's the Stearns and Foster's $5,000 mattress, which I didn't think was that comfortable.
Yeah.
I'm not gonna lie. So I lay on this other one, and now I'm old. I'm officially old because it's like the adjustable head, and the feet come up. It's got the USB ports on the base. I'm like, oh, I like this. It's got zero gravity, so your back is in the perfect position. I'm like, oh, I really like this bed. So I'm like, but I wanted to go to Jordan's. Here's a plug for Jordan's. I wanted to go to Jordan's. I wanted to meet Bridget, the bed machine thing, and everything. Yeah. Okay. So Brian calls me the other day. He's like, there's this mattress store in Revere. You want to go check it out? I'm like, here we go. Am I going to have to wipe the bed bugs off before I lay on it? Like, what are you talking about? So I go down there this morning, and they're going to give us the same frame. I got the zero gravity. I got a little shake. You know, remember the old hotels who put the quarter in bed?
Does it do that?
Oh! That's all I can think of. And they're like, it gives you a massage. That's not a massage. It's like, what is that?
I don't know.
I was watching Planes, Trains, and Automobiles, and he puts that in the bed. The whole bed shaking.
So weird.
So, in the mattress, I laid it. I'm like, oh, this is it. Because I have a memory foam right now.
Ugh, I hate those.
Fucking hate it.
Mm-hmm.
Triple exclamation point.
Mm-hmm.
I will never underline, get another one.
Mm-hmm.
I hate it. I feel when I lay on my side, like my clavicle is shooting out my other shoulder. Right? My spine, my hips, I hate it.
Yeah.
And I think every back problem I'm suffering right now, at this moment, on your futon, is from my bed.
Probably.
So, by the time we record again, I shall have been in my new bed for about 2 weeks, which is getting delivered Thursday. And yes, I got it from the cheesy store in Revere.
Oh, boy.
But it was a nice bed. So I said to him, all right, I'm okay with this because I like this bed. I said, but, we never did go where I wanted to go. Just saying. He's like, it's all overhead. They're going to charge you a ton of money. I'm like, well, all the money I saved in the bed is going to go to the new couch. He's like, wait a minute. Wait. I'm like, you do. Yeah. There's always a catch, my love. Yeah. Always a catch. Okay. Totally on sidetrack about my bed, but I felt like it was something I needed to discuss for the new year because here we are in the new year,
yes, I think
which is very same as the old year.
Pretty much.
I'm hoping it's like March where it comes in like a lion but goes out like a lamb.
That would be nice.
I'm really hoping.
Yeah.
I'm putting money on that one.
Okay,
so we're going to do, we were sitting at work one night and we're like, what are we going to do for January?
Mm-hmm.
And I didn't think we should talk any more death and dismemberment, give you guys a little break before the summer series. And we decided to do awareness.
Yes, January awareness month.
Awareness. So the awareness things in January, one of them is glaucoma.
Nice.
Glaucoma. So we're going to talk about glaucoma. I'm sorry. Did I say that?
No.
I'll try to make it entertaining. I got my information from Medical News Today.
Okay.
Laura, glaucoma. Do you know what it's known as? It's known as the thief of sight.
Oh, I didn't know that.
Thief of sight.
Wow.
Because it's a silent thief. Very quiet glaucoma.
Okay.
Glaucoma is a disease of the eye which fluid pressure within the eye rises. I'm like, did I write this right? As I'm reading it, I really need to reread these things when I have written it like 3 weeks ago. So it's when fluid pressure within the eye rises. Mm-hmm. So you've got your eyeball. The eyeball is hollow. It is filled with this viscous, nasty fluid.
Yeah, that's gross.
Okay, if it's left untreated, the patient may lose vision and even become blind.
Jeez.
Age and thyroid problems can increase the risk of glaucoma. So, anatomy of what is actually going on. All right, it's really hard to give you anatomy of the eye because the eye fixtures you have to see what we're talking about. Like if I'm going to talk to you about the anterior chamber of the eye that has fluid going in and out of it, you have no idea what the anterior chamber of the eye is. But it's so you get the color of your eye, and then your eye has like a little bubble on the outside. Between that, that's your anterior chamber. The anterior chamber, this fluid constantly going in and out of it, it's bathing your eye, it's keeping everything clean, it's washing any impurities out. That's how you see. The fluid nourishes and bathes surrounding tissues as well. And glaucoma is when that fluid either drains too slowly or it builds up, which increases the pressure in the eye. I hate eyes. I hate eyes.
Literally can't stand them.
Yeah, it's disgusting. There's a reason I don't work at the eye and ear. I don't do cataracts.
No.
They put all the nerve block in the eyeball.
They put the big needle in, and then they put that crazy retractor in your
so they're just staring up at the sky.
Oh, it's awful.
Yep. Don't like it. Don't like eyes. Okay. So this can cause damage. I have not even had a drink in 2 weeks. So I swear to you, this is not a drunk episode. This can cause damage to the optic nerve and cause blindness. Obviously, the optic nerve, that's how you see. There are 2 types of glaucoma for glaucoma awareness. So you need to be aware of both of them this month. All right. Open-angled and angled closure. Open-angled, most common. Okay. Everybody has open-angled. Also known as wide-angled. The drain of the eye looks fine, but the fluid just doesn't want to go.
Ew.
Page turn, which means I'm getting through this. I'm getting through this glaucoma. All right, stay with me. It's a slow increase in pressure, so it's painless. You have no idea this is going on, and it usually will go unnoticed until you have damaged your optic nerve.
Okay.
This is why you need to go for yearly eye checks, because they will test you for glaucoma. There are 4 types of open-angled glaucoma. When I tell you, I really dumbed this down because whoever wrote this article is really excited about glaucoma. Like, they were really into glaucoma. So primary, you have low pressure. It's the optic nerve's damage through low pressure. It results from poor blood flow to the optic nerve. It's associated with migraines, Raynaud's, sleep apnea. I was going to say, I might have that glaucoma. Raynaud's. Yeah. Probably going to be blind next week. Oh, look what I found. So we're doing this cleanse. Yeah. And I came over, we had dinner, and she's like, do you want a fizz stick packet? I said, no, I put one in my bag. I looked at the bag, can't find the fizz stick packet. She's like, just take the one. I'll just give you one. I said, I guarantee you I'm going to be doing the episode. Yeah. I'm going to find it. And guess what's sitting on my lap? Pomegranate fizz stick. Okay.
Delicious.
It's delish. So congenital glaucoma. It occurs in infants and young children due to abnormal development of the eye. So in children and young infants and young children, the symptoms are light sensitivity, watery eyes, and a tendency to keep their eyes shut. Well, infants sleep 24 hours a day, so I don't really know how you're going to tell. And the eyes may also appear larger than normal or a little cloudy. Oh. So, yeah, you got to take care of that. Then there is secondary open-angled glaucoma. These are caused by abnormal deposits of material in the drainage angle. Medications can cause this, and trauma can cause this. There are 4 types of this.
Oh, my God.
Oh, well, I don't even want to get into those. It's not even important, okay? There's 4 types of that. Then you have angle closure glaucoma. This is a mechanical problem that exists in the drainage of the eye, meaning the iris, which is the color of your eye, is too close to the meshwork of the drainage. Oh. I don't know why it gets too close. I don't know if it just wants to get warm. I don't know why it's there, but it is. Intraocular pressure rises very quickly, and it is known as acute angular occlusion attack. And this can cause blindness in a matter of hours.
Oh, my God.
Yes, I didn't realize that. Glaucoma is really that little thief of eyesight, but it's also a killer of it. Okay. It can be prevented by a laser surgery called an... I love the I words. Iridotomy. Oh. I think it's iridotomy.
Sure.
Yeah.
Makes sense.
I think it takes your iris out. Symptoms of acute angle closure attack are sudden blurry vision, eye redness, severe eye pain, headache, and nausea.
Yeah, I bet if your eyeball is like full of pressure.
And if you're nausea, you're going to be vomiting. They always go hand in hand. Remember that. They love to be together. They're a married couple. You're going to see rainbow-colored rings or halos around lights. That's part of the attack. There's a couple of honorable mentions. You have chronic angle closure, secondary angle closure, and neurovascular angle closure. I'm just not going to get into it because it's going to get too technical and nobody cares. Okay. Glaucoma is checked for whenever you get your eyes checked. So
that is literally the only part of the eye doctor.
Isn't it when like they put the thing right on your eye?
Oh, it's when they go with the air.
I hate it.
Isn't that the
the one that they actually put it on your eyeball and you're like, ugh.
I don't know.
They put one, and they actually, I think it measures there's like a little cup, and you have to sit there, and they bring it right in, and they put this thing on your eyeball.
Oh, my doctor doesn't do that. He just blows the air.
Maybe you're not old enough.
Maybe, probably.
Oh. You do have a lot of congenital weird shit going on.
I do have cataracts. I don't have glaucoma.
You have a lot of weird shit. Okay. So most treatment for glaucoma is eye drops. You have prostaglandin eye drops, carbonic anhydrase inhibitors, cholinergic agents, and beta blockers. Mm-hmm. Compliance is vital for best results and to prevent undesirable side effects.
I would assume.
So once you start, almost any medication, if you don't take it as prescribed, weird shit can happen to you. Yeah. So take medication as prescribed. Okay. There is no way to prevent glaucoma. If it's coming, it's coming. So get regular eye checks. That is your awareness takeaway for glaucoma this month. Get regular eye checks.
Yes.
Thank you.
Good job.
Okay. Laura, over to you.
Okay, I'm going to do cervical cancer. Because January is also Cervical Cancer Awareness Month. I got this information.
That just hurts in all the wrong places.
I know. Credi Health and Mayo Clinic. The cervix, if you don't know, is the lower part of the uterus that connects to the vagina. So you get vagina, cervix, uterus.
Vagina?
Cervical cancer is a type of cancer that occurs in the cells there. So the signs and symptoms. In early stage, there's usually no symptoms. So you have no idea you have this when you're in the early stages usually.
Okay.
Advanced cervical cancer, the signs and symptoms are vaginal bleeding between periods, after sex, or after menopause. Which, I swear to God, if I stop bleeding after menopause, I might lose my mind.
I would hang myself. But that's a symptom of a lot of things, too.
It is. But if you're bleeding at any point
irregularly,
that you shouldn't be,
go get checked.
Yeah. A watery, bloody vaginal discharge that may be heavy and may have a foul odor.
Okay, discharge. That's another word. Don't like it. Don't want to use it.
No. Pelvic pain or pain during sex. See a doctor when you have any of those symptoms. Okay. Even if it's not for this, there's a problem.
There's something going on. There's something going
on. Causes of cervical cancer. So healthy cells in the cervix develop mutations of their DNA that tell the cells to grow and multiply out of control, and they don't die like they normally would. So usually, your cell lives a certain life cycle and it dies and sloughs off.
Gets old.
These mutations in these cervical cells just tell them to keep growing, and they're not dying at all. So you're getting a
big, huge cervix.
Yeah. So these mutated cells then form a mass or a tumor. Then these insane cells or cancer cells,
these insane cells,
break off and invade other cells.
Fuckers.
Yep. They aren't sure what causes cervical cancer, but HPV definitely plays a leading role in developing it. And we talked about that when we talked about HPV in the STD.
Yep.
Episode.
Last Valentine's Day episode. Yes. We should have done another STD episode for Valentine's Day. Sorry, we picked up presidents this year.
Yeah. Although most people with HPV will never develop cancer, you can, and it is a problem.
Yes.
That is why there is a vaccine.
Which, you know how we feel about vaccines.
So there's two types of cervical cancer. There's squamous cell, which is the most common, and it starts in the outer lining of the outer part of the cervix.
Okay.
The lining is made of flat, thin cells, which are squamous cells. So you have squamous cells
everywhere,
all over. It doesn't mean
you can get squamous cell of the face. You can get squamous cell of the lung,
throat, everywhere. It lines. It doesn't mean like I know some people think squamous cell is skin. It doesn't mean you have skin cancer in your cervix. It is cervical cancer. It's just that type of cell is where it is lined. That's lining that part. And adenocarcinoma is the other type, and that begins in the column-shaped glandular cells that line the cervical canal. So two different cells are being attacked there. Sometimes the cancer is actually in both cells.
Oh, well, that's not good.
No, it very rarely occurs in other cells in the cervix, though. It's usually just the squamous cells or the glandular cells. How they would diagnose you is, you should start screening by age 21.
Easy. You should be having pap smears by then.
I mean, yeah. I've been having them since I swear I was born, but just get them early.
You dirty girl. Come on. 4 years old up in the stirrups. I'm
ready. Let's go. Bring it on. This cervical cancer. So they're going to do a pap smear. A pap smear scrapes the cells of your cervix. Ugh. Then they're
use another word.
I can't. They scrape them.
They brush it they swab it.
They're scraping them. Oh. And then they take them, put them on a slide, look at them in a lab.
They smear it on a slide. Pap smear.
They can show cancerous cells or abnormal cells that show changes that increase your risk of cervical cancer. So I remember I was like 16 and I got a pap smear. And my mother on the phone in her bedroom. And I remember her hysterical crying, if you know my mother.
Oh, yeah.
She cries at the drop of a hat. And I'm like, what?
How are you her child?
Your pap smear is irregular. They found abnormal cells. And I'm like, okay. So, like, am I dying? Like, I don't know.
Yeah.
You know, like.
What does that mean?
Well, you have to go back for another one. I'm like, oh, okay. Like, I'm fine.
Yeah.
FYI.
She's a long way from 16. So she's still here.
And then they can also do an HPV DNA test. And that tests the cervical cells for infection with any of the types of HPV that likely lead to cervical cancer. So they actually test the cells themselves. If they think you have cervical cancer or abnormal cells are found on the screening, you'll probably have a colposcopy, which I have had.
I like that you were able to get that word out and not stumble over it.
Because I've actually had it done.
Yes, but I'd still be stumbling.
Your doctor looks in your cervix with a special lens to check for abnormal cells. They'll also probably do a punch biopsy or an endocervical curettage.
And a punch biopsy isn't they come over, punch you in the face.
No, they take a...
It's literally like a little thing that punches like a ticket.
A hole puncher.
Yeah.
Into your cervix.
Chink.
It's a little crampy.
Yeah, a little bit.
They can do a punch biopsy that uses a sharp instrument to pinch off small samples of your cervical tissue.
God, I'm like clenching. I'm giggling just listening to this.
They can do an endocervical curettage that uses a curette or like a thin metal brush, kind of, to scrape the cervical tissue. They're then all sent to the lab. There's a lot of scraping and punching in this. But honestly, just go get it done. Because it sounds terrible.
But they give you medication.
I've had it all done. It's fine. Nothing's bad. It's fine. You got to do it because the treatment later on is worse than this stuff. If those come back questionable, you can have an electric wire loop, which uses an electrified wire to get a small tissue sample. And that's done under local anesthesia. The other stuff they don't really give you anything for. It's quick. It's in and out. You're done. The electric wire loop, they will give you like Novocaine. Or a cone biopsy, which takes a deeper layer of cervical cells. And that's usually done in the hospital under general anesthesia. Yep. If you have cervical cancer, your cancer will be staged. They will get CAT scans, MRIs, PET scans to see if your cancer has spread. They may also do a cystoscopy or sigmoidoscopy to look for any cancer in the bladder or rectum because that's surrounding the cervix. Treatment depends on the stage of your cancer, other health problems, and your patient, the patient's preferences. Surgery, chemo, radiation, or a combo of the three can be used. For early stage cervical cancer, it's usually treated with surgery. Okay. They go in, they take out the part that has cancer, and you're good to go. So, and definitely go get your pap smear so you can just get it done like that. If you have a very small cervical cancer, the whole thing may be cut out with a cone biopsy. So just a quick office visit, maybe a little local anesthesia. A tracheolectomy.
Here it comes.
I didn't have this stuff. A tracheolectomy.
And there it is.
Or removal of surgery can...
Removal of surgery? Can you do that in my life, please? I wouldn't have to work again.
I think I meant cervix. The removal of the cervix can also be done for early stage cervical cancer. The uterus remains intact, so you will be able to get pregnant. You can have a hysterectomy. That's the most common surgery to remove most early stage cervical cancer. This removes the cervix, uterus, part of the vagina, and the surrounding lymph nodes. This can cure early stage cervical cancer and prevent recurrence. Yeah. Radiation is often combined with chemo to treat advanced local cervical cancer. It can be given externally by directing a radiation beam at the affected body part, which is or internally with brachytherapy, which is when
in your inside yoo-hoo.
Yeah. Which is when a device filled with radioactive material is placed in your vagina for a few minutes.
Doesn't that sound pleasant?
Or both. You could have both.
Yeah. Sounds great.
If menopause hasn't started, radiation might kick you into it.
Maybe I should go.
I know.
Just
why
preemptively.
not? Just do it. You can have low-dose chemo with radiation for local advanced cervical cancer and high dose to help control symptoms of advanced cervical cancer. Risk factors for getting cervical cancer are many sexual partners, because that increases your risk of HPV, so
Right.
that increases your risk of cervical cancer. Early sexual activity, because that increases your risk of HPV, which increases your risk.
And one follows the other.
STIs increases your risk of HPV. A weakened immune system. Smoking,
Ooh.
especially causes the squamous cell cancers.
Interesting.
Exposure to DES, which was a miscarriage prevention drug. If your mom was pregnant in the 50s,
She took it.
she might have taken it, and you have an increased risk of clear cell adenocarcinoma.
Oh, that's weird.
To reduce your risk, ask about the HPV vaccine.
Bing, bing, bing. Rule
get
number one for
routine-
January awareness.
Right. Get routine pap smears. Go get your pap smears. Practice safe sex, and don't smoke.
So my horror story is we had a 30-year-old within the past 2 years come in. Terminal cancer. She had never had a pap smear. And she was dying from cervical cancer because she had never had a pap smear. So, January, you're going to go get an eye test.
And
You're going to go down in the hall to the gynecologist and you're going to get your pap smear. And then after that, you're going to make sure you don't have a child that has intestinal malrotation or volvulus. Because shockingly, January is also Intestinal Malrotation and Volvulus in Children Awareness Month.
Wow.
You know, I love all the weird shit.
I know.
We're going to have, like, what color ribbon would you wear for this? Shit brown?
Brown.
Okay.
Yeah.
Shit brown. Now, you can tell how lazy I got when I was doing this because I just printed it off. I highlighted it and I'm like, oh, just fucking talking about this. Because the day I was not into my stuff. People were talking to me and I was like, oh God, we were supposed to record before and we weren't feeling well. So it's a long story. Okay. So intestinal malrotation and volvulus. Little medical terminology in medicine. MAL always means bad. Malpractice. Malrotation. Bad rotation. Malfeasance.
Ooh.
That's a legal term. I don't know what it means, but it's bad something.
But it's bad.
It's bad. And this shit's so tiny. I don't know if I can read off the piece of paper.
God.
Okay. Intestinal, let me move my microphone a little bit here. Intestinal malrotation is a birth defect. It happens when your baby's intestinal tract doesn't form as it should during pregnancy. Malrotation happens when your baby's intestines doesn't turn like it should. You can have malrotation as an adult as well, and we see it. It's for some reason your bowel just twists up, and when it does that, nothing gets through, and the pieces that are twisted will die. This can cause a problem called a volvulus after your baby is born. In this condition, your baby's intestines get twisted. I just said that. This can cause an intestinal blockage, and when this has happened, it's very bad.
Yes.
It also cuts off blood flow to the intestine, and this can damage your baby's intestines. And, you know, they only have so many. You only have so much, and they can only cut out so much because then you get short gut syndrome and you get all these other weird things that'll happen if you don't have enough intestines. It looks like a lot until you start chopping away at it.
Yeah.
Most children with this condition have symptoms within the first year of life. Some people who have had malrotation go their whole lives without even knowing they have them and are never diagnosed. Other people's may not have symptoms until adolescence or adulthood, because we do see this come in.
Yeah.
You know, you can also have a malrotation of the testicle.
Yes.
You can have a malrotation of the ovary. That's an emergent case as
Bad.
well.
Bad.
Yes. So what causes a malrotation or volvulus in a child? Laura, you asked the best question. Let me tell you. Malrotation happens in the early stages of pregnancy. Didn't I just read this? When your baby's intestines don't form the right way. The volvulus is called by the malrotation. All right. Malrotation happens equally in boys and girls, but more boys have symptoms by the first month of life than girls, because girls are just stronger.
They're tougher.
Brian and I actually had this discussion. He was like, yeah, women are the strongest sex. I said, honey, when there's twins, it's always the guy that dies.
Always
the male
the
that
girl's
dies.
the strong one.
We are strong. It's all that propaganda. It was all that fake news you guys put out that you're the stronger sex. Babies with other health issues have a greater risk of having a malrotation. These problems include a diaphragmatic hernia. A lot of these kids come out, their intestines are in their chest when you have a diaphragmatic hernia. Phalocele, I'm not really sure what that is. And a duodenal atresia. That's your duodenum is really like shrunken, isn't it? It's like it's like not there. Okay. Symptoms of malrotation and volvulus in a child. vomiting green digestive fluid, also known as bile.
Yeah.
Drawing up the legs. So when you'll see this
Yes.
with any baby with gas pains, they bring their legs up and they're screaming because they're so uncomfortable. Stomach pain, swollen belly, diarrhea, constipation. So one or the other, I guess, or both. Rectal bleeding, failure to thrive because they're not eating because they've got this big twist going on. Fast heart rate, fast breathing, and that's it for symptoms. So what can be done? How do we diagnose this? They get a health history of the child, and they will also give the child an exam. You're going to do blood tests. They guaiac the stool. You got CT scans. They do x-rays, barium swallows, which they give you that nasty white chalky substance. They have it go through your intestines, and they take x-rays while it's going down. That's for your upper GI. They will give you a barium enema where they shoot that chalky stuff up your butt, and then they do the same thing. A flexible sigmoidoscope, which is when they put a little flexiscope up your butt. So how do you treat it? Treatment will depend on your child's symptoms, age, and general health. It will also depend on how severe the condition is. The volvulus is a life-threatening problem. So this is because the intestine can die when it's twisted and it doesn't have enough blood supply. So they're going to get antibiotics to prevent an infection. They're probably going to need an NG tube, which is a tube that goes down your throat. They have an NG and an OG. An NG is in your nose, and OG goes down your esophagus through your mouth. They both go into your stomach to drain the fluid and everything to keep... If somebody has a really bad blockage, it's actually going to drain stool through your mouth. I know that's
just
gross,
emptying out everything from your gut.
It's keeping it out so that you're not going to have other problems because everything's blocked up. A child with a volvulus is going to need surgery as soon as possible. It's an emergent case because you're trying to save the blood supply to the bowel. You're trying to save the bowel. The child's surgeon will untwist the intestines, and they will always check it for damage. They run the bowel. That's the famous, we're going to run the bowel. Your child's intestine will turn pink after it is, I don't know why we had to go into this, because they're not going to be in there to see. So when it comes in, and they open up the belly.
It's like a blacky, bluey.
Yeah, it can look many ways. It can be dusky, like a dusky gray. It can be bluey black. That's not coming back. They're cutting that out.
Yeah, that's cutting that out.
And then if it's that dusky gray and they untwist it and you can see it almost immediately, it turns this pretty little pink. Intestines are a pretty little...
We watch it for a couple minutes.
Yeah, it's a pretty pinky gray color. Okay. So they're going to give you surgery. If your child's healthcare provider isn't sure about the blood supply to the intestines, your child's intestines may be untwisted and put back into your child's belly. What? What did I just read? So I don't know why I'm reading the surgery part because I know it. So they untwist it, they stick it back in, they make sure they kind of jiggle it around, especially in little babies because they're so tiny. It's hard to put everything back. They kind of
they kind of
shake it
like
a pot of spaghetti.
I was going to say like a thing with spaghetti.
If you're in the colony, they kind of shake it, put it all back together. They're going to sew the baby up. Yeah. Okay. What are the complications of a malrotation of volvulus in a child? It can cause Ladd's bands. These are stalks of tissue that form between the cecum and the intestinal wall, and they can form a blockage and keep food from being digested. So it's adhesions. You're going to get adhesions anytime you go into somebody's abdomen for any reason. Your abdomen responds by creating adhesions. If you tend to create lots of adhesions, it's going to clog up your bowel because your bowel can't get around the adhesions, or it's hung up on an adhesion and it's going to twist because your bowels move around with you. So if you know
when you literally feel it move, like it's
moving around in there. So if it moves the wrong way, it's going to get hung up on an adhesion and you're done. So a volvulus is considered the life-threatening, and we've already talked about that. Most children who have volvulus go and get surgery. We've talked about that. So we're going to have our eyes checked. We're going to the GYN. And you're going to make sure when your kid is born that they're not screaming in intestinal pain because they have a malrotation of volvulus. All right. Back to you, Sparkles.
Okay. January is also National Blood Donor Month.
Oh, very important, very important, very important.
I got this from few.org and the American Red Cross. So National Blood Donor Month has been celebrated since 1970.
That's it?
I know. They do it in January to try to increase blood and platelet donations during the winter.
Oh, that makes sense.
Yeah. It is more difficult during the winter months to collect all the blood needed because weather causes a lot of blood drives to cancel. People don't want to go out. There's the flu. I wonder
what's happened with COVID with the blood drives.
So I don't think they have the blood drives anymore, but you could definitely go to your...
But I wonder how it's affected it way.
Oh, yes.
Like how...
It's definitely down.
Yeah.
I know when we go into work, if you go down to the blood bank, you can give it anytime because they're in desperate need of it. And plus, they can't take it from you if you've been sick or you've been in contact with somebody sick or,
Right.
right.
So, right. What about if you just have the vaccine?
I don't know. I think they are encouraging that because they're encouraging people who are recovered to donate because that's helping people.
Interesting.
But I don't know about the vaccine.
I lost the memo that says if I got my vaccine, I need to put it on Facebook. So I didn't put it on Facebook. So everybody may not know I had my vaccine.
Right. We both did. So anyway, so they cancel a lot of drives because of weather and you have the flu going around. People don't feel good. They're sick. So people don't give in the winter a lot. So if you got nothing to do, like we do, find somewhere where you can donate blood and go.
I may do that next time I go to work.
Blood. So people over 17 and 16 with parental consent in some states, weighing over 110 pounds and in good health, can be eligible to donate. So what happens when you donate? I used to donate all the time.
I used to too.
I can't anymore because we have that hemochromatosis and you can't donate blood.
I haven't been able to do it in a long time because my kids sucked the life out of me and I'm chronically anemic.
Yeah.
So I haven't tried and probably since Garrett was 2.
Yeah.
So I probably should try again.
I used to go all the time. My friend Katie, I don't know if she went literally all the time. Like on the day she could give, she would be back.
I'm O negative, so I can give it to anybody.
Yeah. I'm O positive, but still, anybody. Yeah. Just go donate because somebody could use your blood.
Right.
Anyways, so when you get there, they're going to ask you for a picture ID. They'll give you like an info pamphlet to read.
Said an infant. I'm like, they give you an infant?
No, they don't give you.
Here, hold this.
Yeah, just see. So let's see how good you are.
It'll help you blood.
So you read it and see if you're even eligible to donate at that time before they start any of their process. They ask you for your address. You'll fill out a confidential screener about travel and your health history. There's a ton of questions you got to fill out. You'll be like, these are the most random questions I've ever heard in my life, but fill them out. They're important. You'll have to tell them about medications you take. They'll check your blood pressure, your pulse, your temperature, and your hemoglobin level. It's like a little teeny stick in your finger, and they can tell if you have enough.
Yeah, see if you're anemic and you can't donate.
When you're ready to donate, they'll place you on a bed or a recliner in some places. They'll cleanse your arm. They really scrub it.
Oh yeah,
it's not like getting a blood drawn at the doctors.
No,
they
not even
scrub that. They insert a sterile needle. It's a quick pinch in a second. They usually have you squeeze like this soft ball while you're donating your blood. And my mother comes home with them every time because she has to give blood because of the hemochromatosis. Yeah. She has to go get leaded, and they give them to her. She's like, "Oh, here, everybody wants." I'm like,
"Here's another squeezy ball."
Yeah. It takes about 10 minutes to donate a pint of whole blood. 10 minutes. You can.
You're in and out.
Do this,
and they get great cookies and orange juice afterwards.
Yeah. When you have donated a pint, they remove the needle and bandage up your arm. If you are donating plasma, you'll be hooked up to an apheresis machine, which is connected to both arms. It collects a small amount of blood from one arm, removes the platelets, and returns the rest of the blood through your other arm.
Well, I don't want my blood now. You took all the good shit out of it. Keep it.
It repeats this cycle several times over 2 hours. So when you donate plasma, it is a...
But it's important. Plasma is important.
My friend Katie used to do that too. After you donate, you'll get a snack and a drink. You'll wait about 15 minutes, and then you go on your way, knowing you made a huge difference.
Yeah.
You really made a huge difference in someone's life. And usually they're giving shit out. Like, here, take
T-shirts,
a t-shirt.
free parking.
Right, like, and the snack and the drink.
Yeah. I say free parking because hospital employees, they'll give you free parking out front at the close garages if you give blood, or they give you this cues. I like the t-shirts. I haven't seen the t-shirts in a while, but they used to have funny Halloween ones and stuff, or tickets shirts to the gift shop or whatever.
Yeah. There are health benefits for blood donors.
Oh.
You get a free blood test. They will let you know if something is abnormal. Right. So you're checking up on yourself. You have the satisfaction of saving human lives.
Which is good for everybody.
Right. It burns 650 calories.
Oh, shit. I'm going tomorrow.
I go to a bar class.
And I'm eating McDonald's while I do it.
When you can burn 650 sitting there for 10 minutes.
Could I do it every day?
I mean, no, but...
I would be shoving food that's it.
It reduces your risk of heart disease by eliminating excess buildup of iron.
Mm-hmm.
And that also reduces your risk of cancer.
They're really stretching the benefits here, okay? Reduce your risk of iron, which reduces your risk of cancer.
It
really
does.
I've never had a problem with like a high iron. I mean, I'm anemic.
I know. Fast facts.
Fast facts.
Okay.
Those are my favorites.
Every 2 seconds in the U.S., someone needs a blood transfusion.
Yes.
Every 2 seconds.
Yes, that's true.
About 36,000 units of red blood cells are needed every day in the U.S.
I believe it.
About 7,000 units of platelets and 10,000 units of plasma are used daily in the U.S.
Yes. If not more.
I know. Average red blood cell transfusion uses 3 units. So usually when you're giving someone blood, they're getting 3 units of it.
Unless you're in a trauma and it's 43
Oh my
units.
God, it's a ridiculous
The floor is
amount of
littered
blood
with blood bags.
Blood type most requested by hospitals is...
Oh, negative.
Oh, it's just the blood type.
Negative.
Negative. There are about 100,000 people with sickle cell disease in the U.S. They may require blood transfusions their whole lives.
Yeah.
American Cancer Society estimates more than 1.8 million people were diagnosed with cancer in 2020. A lot of them need blood, especially during chemo.
Yeah.
So that's 1.8 right there, just
Yep.
living regular lives. A single car accident victim can need 100 units of blood.
Yep.
I've seen that
Yep, we've seen
personally. Just in the OR, never mind when they get to the ICU.
That's just the blood. That's not the FFP,
No.
albumin, and everything else they're giving them.
No. Only 3% of eligible donors donate every year.
Wow.
Yeah.
That's pathetic.
Yes.
That's pathetic.
13.6 million units of whole blood are collected in the U.S. yearly. O negative can be given to patients of all blood types. About 45% of people in the U.S. have type O,
I'm a giver.
but only 7% of population is O negative. So it is always in high demand.
I am
You
a
are
rarity.
special. Type AB plasma can be used in all blood types, which I didn't realize.
So I think because O negative, your blood doesn't recognize anything. There's nothing on it. There's no proteins on
Yes.
it. What did you say? AB
Plasma can be used in all blood types.
right? Because
I didn't know
because
that.
I think one is the universal receiver. They can
Yes,
receive.
but this is to give
Right.
plasma. It's different with plasma.
Yeah, you're right. Because I was like, it gets confusing.
No, yeah. AB is the universal recipient.
Yes,
O
that's
is
it.
the universal
because
donor.
it has everything on
Yeah.
it, so it recognizes everything.
But type AB plasma can be used in all blood
That's
types.
bizarre.
Yeah.
I didn't realize that. Okay.
Me neither. Only 3% of the U.S. population is type AB.
Yeah.
So it is always in short supply.
Extremely
so
rare.
If you are AB, please think about donating plasma. RBCs have to be used within 42 days.
Red blood cells.
Red blood cells, sorry. Platelets have to be used within 5 days.
Ooh.
To make a donation, download the American Red Cross Blood Donor app, go to redcrossblood.org, or call 1-800-RED-CROSS.
It is
Please
very
donate.
important.
It's
Donate.
really
It
important.
is, like I said, I used to do it all the time. All the time. Because it is important. On this end, we see how it changes lives. It really does. It saves lives.
Oh yeah,
Blood donation saves lives.
and it's a critical low. It's always in a critical low level. Like
Right.
we'll be doing these huge traumas, and they're calling up like, "What are you thinking?" Because this is an awful lot of blood, and there's other people that need it too. Not that they don't give it to, but they're just saying, "Okay, can we think about something else?" Because you can't burn. There's only so much blood that people donate.
I remember the Rhode Island fire. You couldn't get in to donate blood.
Yeah.
So many people donate, which I thought was fantastic. They were
Yeah.
actually saying to people, please wait. We'll give you a date. Please wait, because they had... And I just thought that was great to see that.
Yeah. But plus, like this, it only lasts 42 days,
Right.
and then the platelets only last 5.
But I think we live in a world where all we see is shit. How bad people are. How everybody hates each other. Everybody sucks. You suck. I suck. I hate who you like, and I hate you. When you see something like that happen in the human response, it warms my heart to think like people really do care, and people really, really try. We just need to get back there somehow without trauma.
Yeah.
Okay.
So, but only 3%. So please, if you're listening,
You have to. I mean, 3% of the world population. Like, come on. Of the population of the United States is donating or whatever blood donors.
That's ridiculous.
It is ridiculous.
So please, if you are able to,
donate.
It does not harm you in any way.
Give the gift of life.
You feel fine literally when you leave. Like it's.
You get cookies. You get crackers. They give you like a plethora of junk food to choose from.
Please look up the Red Cross and see when
600 calorie burn. You could bring a Big Mac
seriously.
with you. You could have half the McDonald's menu.
You don't have to exercise that day. Like, how good is that?
It would be great. You could have one of your stackables while you're doing it.
Oh yeah.
Yeah. So we're gonna get your eyes checked. Get a Pap smear.
Mm-hmm.
You're gonna make sure you have no children with weird shit going on in their bellies, and then you're gonna go give some blood, because that's what you should be doing in January.
Yes.
That is the awareness for January.
Get out there. You got nothing else to do.
Exactly. So, you know how I love fan mail.
Uh-huh.
And we got a couple of fan mail
I
letters
know.
all at once. I was so excited. I love when I see we have a little text thing that pops up for Scissors and Scrubs. And it pops up, and I'm always like, God, please, I hope this is Mike sending me some kind of like fan mail something. I love to read them. So we're going to read 2 of them. Which one do you want to read, Laura?
I don't care. Do you want to just start? No.
All right. Okay. You know what's funny is we apparently have a big fan base in the South.
I swear
and
to God,
I
they
can't
just
say
must be
y'all that
making-
easy.
They must be making fun of our accents because I don't know what else.
Because I think every letter we've ever gotten is, "Hey y'all," and I'm like, "Yep, I don't say that right, but I'm trying." All right, I can read them in order. Like I got the first one was the longer one. Or
Yeah, do that one.
Okay. All right. So this is number 1. Again, all my writing is small. Hello, ladies. I am a new listener to your podcast. Well, welcome. I hope you made it through the penis episode. I just finished episode 33, so I think she did.
Yeah.
If you're listening in order. I'm not sure if y'all have done an episode about the first day on the floor as a nurse, but here's my little story. Well, we're OR nurses, so we don't do the first day on the floor, but we do have our first episode of the very
Like our
first
firsts.
episode is all the first shit we saw. Anyway, I started working in the ED less than 2 months after completing my nursing program. God bless you.
God, that's a transition.
Yeah, no kidding. That's like from the frying pan to the fire.
Yeah.
I had a week of orientation and then was promptly started on the floor. Jesus, where the hell are you working, kid? Chicago? My first day, I was involved in my first code.
Of course.
Of course it is. The room is full of nurses, and I honestly had no idea what I was doing. None of us do.
Mm-mm.
Someone said, so get a blood sugar on the patient. So I decided I can at least handle that. I am shaking so badly with adrenaline, so obviously even getting a blood sugar was like a challenge. Anything. I just said to somebody, I'm like, when I'm into trauma, I can't find anything in the cabinets.
No,
it could be
nothing.
in my hands. I'm like, I don't know where it is.
Yeah, it's adrenaline level.
It's ridiculous. So there is another nurse who leans over to help me. She proceeds to stick me with the dirty IV needle. That's a help. Here, I'm going to give you some HIV. That she had just used on our drug overdosed patient. Oh, Merry Christmas. She asked something along the lines of, "Oh, did I get you? Did I do that?" Yeah, you did. I say yes, and I immediately go and wash my finger in hot soapy water. So clearly I'm freaking out even more than I was before. So now she's not just shaking, she's practically convulsing probably.
And that hurts.
Yeah.
Yeah.
Oh yeah, I did it. I'm such an idiot. I'm an idiot. How am I a nurse? I don't know. So I'm in a hurry. I'm nervous, and I'm trying to put a medication in the IV bag, and I stabbed myself through the IV bag.
Jesus.
Because it's a little
you're holding that.
I fell in the blood, and I was like, I pulled out. I'm like exsanguinating, and I'm like, I gotta change the IV bag now. I look like an asshole. Yeah, so it hurts like a mother. Okay. All right, I keep losing my place.
Keep my composure.
I keep losing my... All right, so clearly I'm freaking out more than there was before. I keep my composure and I continue to help it any way I can. Not much, bless it. Then when the code is done, I walk up to my mentor who I have to switch to the next picture because it was sent to me via picture. So just give me a second. I'm not technically savvy. Okay. So I walk up to my mentor who I have barely spoken to and I tell her what happened. I was holding back tears. It's frightening when you have these... They're like a petri dish of God knows what when they could be HIV, Hep C. It's terrifying.
And you're also coming down from the adrenaline, so everything in your body's just crazy.
And you're like, I just fucked up. Blah, blah. She sighs and says, we need to go and tell the charge nurse. I respond, she knows. She's the one that did it. It's pretty bad when the charge nurse is the one that fucking sticks you. I don't even have the words to describe her reaction. She was as annoyed as fuck. That's me every day. Yeah. She was as annoyed as fuck. She takes me into the office, and the charge nurse ends up taking me to employee health, which are good for nothing. Mm-hmm. They ask me a ton of questions and
provide me with... Unless you're an employee health nurse, and we appreciate it.
Right, exactly. Yeah, that's it. They provide me with ample education. Luckily, the needle that stuck me didn't draw any blood, so the chances of something being transmitted were basically nothing. I also learned that in such a case, you should clean the area with alcohol rather than soap and water. Thanks for nothing, nursing school. Yeah, it really does nothing. When I got out of there, the charge nurse was still waiting to take me back down to the ED. Are you out of your fucking mind? I'm going home. I've had a traumatic event. We've had nurses go home for less. Okay. She was very kind and apologetic, as she should be. She should have bought you coffee. Mm-hmm. But that if that isn't considered being baptized by fire, I don't know what is. You're absolutely correct. That's out.
Show of a
first day one. Yeah. But you know what? It's lounge talk. That's what I say. It's something. No, it's a story to tell. And this is a story to tell. Scissors and Scrubs. I didn't work there long. No shock. Just because of the circumstances. but I did learn so much. The day put the fear of God in me. I have seen a few people get stuck with dirty needles now, and the experience has given me the understanding to both make sure that my coworkers know what to do and give them the support they need emotionally. I love listening to y'all. Thank you for sharing all that you do. We love having you listen to us, and we love sharing all our weird nonsense.
Thanks, Tess.
Yes, we've all been, Laura and I both been stuck because we work with needles. We work with sewing needles, not sewing needles, suture needles and hypodermic needles. I've stuck people.
Blades.
People have stuck me. Yeah, sliced with blades, saw blades.
Oh, yeah.
And it's terrifying every time. So I get it. So thank you for your story. Greatly appreciate it.
I don't know if we told this story about being stuck, but our friend KU was scrubbed one day, and I'm circulating the room, and she scrubbed in, and she had her 2 closing sutures on the mayo, like on a tray, ready for the surgeons. And then she was telling me a story, and she is using her hands, and she put both her hands like slapped down onto the mayo. Literally, she stuck herself with both sutures in one hand and one in the other. Literally the same spot. She's like, it's hysterical. And I'm hysterical laughing. I'm like, hey. They're like, what's going on? When she just stuck both her hands. So held them up. She was literally like, it's like in the palm of her hands. Both of them. It was so funny. I mean, not funny, but it was so funny.
And then you pull it out and you watch
hurts.
the gloves just
fill up with blood.
It's such a good time.
So much fun. That was the best stick I've ever seen.
Oh my God, I've done it, and you're just like, and it's
hurts.
like, and you've got this curved needle sticking in, and you're like, and you have to finish the case. You're like, I need a new pair of gloves and some betadine.
I know.
We do it all the time, so
it's bad.
Sorry you got stuck. I know it was a terrifying experience, but it's a good story for Scissors and Scrubs.
All right, so we have this one. Y'all.
Oh, I love the y'all.
I love your
I love that they write it. Like,
I do too.
We say wicked stupid shit, but I don't usually write it in. But
Right.
I love that they write it. Okay.
I love your podcast so freaking much. I listen to
I
you
do
on
too.
I know. I listen to you on my way to work, at work, on the plane, everywhere. I love the way you tell the stories, and y'all are fucking hilarious.
Yeah, I think so too.
I feel like I'm hanging out, having drinks of coffee, and just laughing my ass off with both of you. Not only that, but I have learned a lot from y'all.
Thank you. Because I think I'm pretty stupid. But thank you.
I have told the coconut growth story probably a dozen times.
One of my favorites.
Yeah, me too.
One of my favorites.
And the Halifax story was riveting.
I thought it was pretty riveting.
Yeah. I forced so many people to listen to it.
Good. Well,
Keep
at least
going.
now they know.
Keep doing it. I'm not sure if you've already covered the MGM fire in Vegas because I haven't listened to them all yet. But could you if you haven't? It's a fascinating story, but I don't know all the details. I would love to hear it in your style. Keep it up, y'all. Jess. Thank you, Jess. I think that sounds like an excellent idea.
I don't think I've ever heard of the MGM fire in Vegas.
But
so
I think
we're on it. We just got to figure out what juicy little tidbit we'll pair it with.
We can kind of talk
Who
about
else
it in
is
some
gonna
sort of
die in that
medical way.
episode? Who's going to get named and mangled? Oh, I can't wait. That might be February. Who knows? So those were 2 great letters we got.
Yes.
Keep them coming. We love
so
to hear. Like, if you see my face light up when one of these pops up on my little feed, and I'm like, oh, I was telling the kids, I'm like, I got fan mail. They're like, Ma, get a grip. I'm like, shut up. It's all I got, guys.
I'll
okay.
I'll take it.
So, this is the end of the January episodes. We will see you in February. We got some fun stuff kind of geared for February, at least half of it anyway.
And we'll see what the rest brings.
Yeah, and apparently we've got a March episode with the MGM.
I know. Oh, yeah.
I think we might do that.
Yeah.
And we will see you in a couple of weeks. The year is going to get better. I'm convinced March is coming in like a lion. 2021 is coming in like a lion and going out like a lamb.
Please.
So let's just see where it takes us, for the love of God. I've gotten vaccinated. We can get everybody vaccinated. I got to get these masks off my face, and I have to talk to people, please.
I just can't even fathom,
Life going back to normal?
Well, yeah, I was
getting my kids in school again?
Yeah, I'm walking with my friend Rebecca. We're walking. And then I'm like...
I like the image of you
because
can't
it's
see
fast.
it.
It's like, so then we're saying something, I'm like, she's like, I only have 2 things to do today, so I'll be done with that in like an hour, so I'm pretty sure. I'm like, yeah, I got nothing to do today. So, and I'm like, what the hell are we going to do when life goes back? And we're like, what the fuck? How did we do all this shit before in one day?
You know what? When life goes back, I guarantee you half the workforce is going to be working from home.
No, but I mean, even just like okay, you got to get the kids from here to
Right,
here to
right,
here to here.
right.
Like, we don't have to do that anymore.
Well, on
so
the
it's
other
just-
side of this, I'm going to have a kid that's driving.
I know.
I'm going to have a third driver in the house.
I know.
I may even have a graduate if this continues much longer.
I know.
I mean, my kids, by the time they're finished, won't need school anymore.
I know. But it's just going to be like, so we're going to be like, shit, how
Yeah.
did I fit all this stuff into
Yeah,
one day?
exactly.
Like,
I
that'd be
just want to
crazy.
see people. I want to go out. I want to have a restaurant and be fun. I want to sit at a bar and laugh. And
I want to go dancing.
I want to go dance. I'm dancing in the shower way too much because I'm like, oh, it could be
I'm dancing around the house. My kids think I'm nuts. I'm
I
like, I just want to go
need-
dancing.
Oh, my 90s hip hop. I'm
Yeah.
like, oh, I got to get out there.
Yeah.
Okay.
Anyways.
We will see you next week. Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsnscrubs@gmail.com.